The following segment is sponsored by Oakview Medical Associates.
A new school year is approaching, and our kids are deep into their summer routines right now. Are they nervous about going back? Are they worried about other things more than you'd want them to be? Dr. Nina Bashir is here to talk about mental health with us. Good morning, Dr. Nina.
Morning. How are you?
Good. It's good to see you. Our environment is full of stress and anxiety, and feeling those things is part of being alive. So let's start with that. A certain amount of nervousness is normal, right?
Yeah, most people have, fears, anxiety, what if, fear of the future, unknown. But really, teen depression is increasing, and it's really something that we need to focus heavily on because that's our future.
And the concern is kind of the slippery slope. Does anxiety or feeling low cause a teenager to slip into a full-blown recession or depression?
Yeah, they're kids, so we really need to be very compassionate in our approach towards our children. What happens is when a teen feels low, it's usually most of the times because of the stressors around them, the pressures, the peer pressure, the external pressure, or they're being bullied or something and they're not able to open up or express that. Sometimes they do it to seek attention too. And it's really important for us to identify those risk factors that are, now compared to 2009, in 2019, 1 in 3 teens between ages 12 and 17 express some form of hopelessness, depression. It's actually about 17 to 20% of our teenagers are experiencing depression. That's a high number. And 1 in 6 have expressed a suicidal plan. Yeah. So it's not to be taken lightly. And so we as physicians, when we encounter anyone that opens up to us, we really want to have a good management plan for them to prevent anything tragic from happening and to really get them the support and gain their confidence.
What are some of those signs then of depression that would concern you, things that parents should be looking for?
That's a great question. Sudden, isolation or depressed energy, they're not wanting to wake up, sleeping all day, sleep disturbances, appetite disturbances, just trying to avoid things, sometimes just lack of motivation, not wanting to do anything, not wanting to go out with the family. If you sense it, approach it and in a very nice, kind manner and get them heavily involved in things that you're doing. And please mention it to your medical provider because there is help. There are a lot of cognitive therapies, there are medication plans, and just like we would treat high blood pressure or diabetes, depression is a clinical condition. What happens is when we face stressors, our body responds by declining or decreasing our serotonin and mood hormones. So we obviously have medications that can help boost those mood hormones. So we should have an open approach, an open-minded approach, and really seek the help that's needed.
Right. So it's all about having, you want to start with that open dialogue. Kids need to know that their parents are interested in how they're feeling and what's going on at school. But you handle everything at Oakview Medical Associates. You deal with the whole family. Talk to us a little bit about your practice and what makes it special.
So we are family medicine, and that is the core of our philosophy. So just like, for example, in teen anxiety and depression, we want to bring up that dialogue. We want to get the family involved, of course, with confidentiality issues and everything. It's a very sensitive topic, but we want to educate our parents also. And what we can do as, community and schools is just make it part of our curriculum that it's okay to feel low. It's okay. Don't make us feel embarrassed about it, but let's get us together, let kids know, let us talk about it. When I grew up in my high school, actually, we had a emotional intelligence class that was conducted once a week. So we kids really understood emotions and fears and how to channelize that and use it effectively. And I think we need to bring that back. Somehow with social media and all that, there's more isolation than ever before. But I think, just participating in the kid's life, I call it conscious parenting. A parent needs to be very conscious about the efforts that they make to involve the kids in their life and their health. Be involved in the school with the teachers, the administrators, get involved in the extracurricular activities, volunteer at your child's school, know what's going on. Because almost 100% of the time, this is something we can prevent and we can help these young, vulnerable kids grow up into healthy, confident, strong, empowered individuals. So there's a lot that can be done, and I'm very passionate about it, as you can see.
I can tell you're very passionate about it, and people can have those discussions with you.
Yes.
And people love working with you at Oakview Medical Associates. You're at 11 Five Forks Plaza Court in Simpsonville. The number 627-0444. Dr. Nina Bashir, thanks for the conversation. It's an important one.
It is. Thank you.
And we also want to let you know mental health awareness will be the theme of this year's India Day event in downtown Greenville. Oakview Medical Associates will be a sponsor.
They'll have information on their site about lifestyle medicine. It's taking place August 20th at the TD stage behind the Peace Center. During that event, you can also sign up for Oakview's first Walk with Your Doc. That free event happens Saturday, October 8th at Unity Park.